Well, part of that is a poll released today suggesting that 60% of young people in South Africa have felt the need for mental health support. Toby Fricker is the spokesperson for Unicef, who conducted the poll. Toby, good afternoon to you. Have I read this right? 60% seemed to be a very high number. Was it higher than you were expecting?
Yeah, you're right. 60% is a very high number. But interestingly, we did a similar poll the same time last year, and it actually showed around 75%. So what we've seen is actually that number come down. Now, it's hard to obviously pinpoint exactly why, but if you look then at the ages, the variance between ages, we see that between 15 and 19 years of age, it's actually higher. So we saw 70% of 15 to 19-year-olds saying they felt like they needed some form of mental health support. And of course, that's very worrying because that is speaking to children who are in school, to the youngest children who are just starting out in life, really. So that's a big concern. And a lot of those also stated they didn't know where to get the support that they felt they needed. And that's where we really need to help to step up and provide the resources and support that we can.
There's a much bigger emphasis on mental health now than there was in the past. In fact, let me try and put that in a better way, Toby. There's a better understanding of the importance of mental health now than there was in the past. And in the past, people just didn't really talk about it. Is there any way to compare how our young people feel now with how the generations before them felt at a similar age? I mean, is that impossible?
Yeah, I think it's a very good question. And I think it's very hard to make that comparison. Myself as a child, I never spoke about mental health with my parents, and that was a norm. I don't think anyone really did. And you see today this conversation has opened up, and that can only be a positive thing for children, for young people. We actually saw the child gauge that was released in 2022 by the Child Institute at the University of Cape Town actually spoke to that. It said, the one positive that may have come out of COVID, if you can put it that way, is that it opened up more of a conversation around mental well-being. And that is a very positive thing, because what we really are sort of advocating for, let's say, is trying to get that nurturing, caring environment at home from the start of a child's life, that early childhood development. Because if parents and caregivers can open up that conversation early as well and provide us with that stable environment that children need, you can really then save in the long term, save in terms of the mental and physical impact on children, but also save costs from a health impact of mental health.
One of the things about COVID-19 is that it may allow us to track levels of stress in society and issues around mental health in young people. Is it possible to see that during times when a society is under greater stresses, ours is at the moment, that you start to see these numbers picking up in young people?
Yeah, you do. I think, everyone's going through a lot of the stress in terms of sort of the rising cost of living, parents and caregivers, who are trying to survive on an everyday basis and at the same time trying to bring up their children. And so they are facing extreme stressful environments, but having to try and hold themselves together to then bring up their children in the best way possible. And that's why we're also promoting and supporting sort of parenting programming that can provide that additional layer of support to parents, to caregivers, to enable them to then, to be able to better support their children, whether that's opening up a conversation, whether that's identifying early signs of potential mental health issues, and then being able to deal with that and provide the support that they need. But it's absolutely critical, because children's well-being really starts at home.
Toby Fricker, thank you, spokesperson for Unicef. Really appreciate the time tonight.